Hi, everyone. I'm Michael. I am a wellness associate at Geisinger, and I'm excited to speak with you today about digestive health. And today's presentation is called Go with Your Gut. So we will be talking all things gut health today. If your social media feeds are anything like mine, chances are this is a really hot button issue for you. I see a lot of things about kombucha, probiotics, prebiotics, and a lot of other things. So we'll dive into that. But before we begin, let's just share our disclaimer here. This information is being provided in order to increase your awareness. It is not intended to be medical advice. If you believe that you may have any medical conditions or have specific questions regarding your health, see your physician. So, what is the digestive system? So, we'll be talking about all of the mechanics of digestion from start to finish, the different organs that make up the GI tract. Then we'll dive into some other topics, such as different common disorders of digestion, when to see a doctor, and we'll end on some tips to improve your gut health. So, the digestive system is also called the GI tract or the gastrointestinal tract. And from start to finish, it includes the mouth, esophagus, stomach, small and large intestines, rectum, and anus. It also includes organs such as the liver, pancreas, and gallbladder. Taken together, all of these different organs are responsible for breaking down food into nutrients that the body can use for energy, growth, and cell repair, and really just to keep us alive. As you can imagine, each part has a job. I will go through this section rather briefly, just because I feel like for most of us, it is probably somewhat common knowledge. And I think where we will spend more time is discussing tips for gut health and the common disorders, so that way you can get set up with the healthcare that you need. So, digestion starts in the mouth. It starts by mechanically breaking down food through chewing, and saliva also begins the process of breaking down food as well, especially carbohydrates. Food that has begun to get broken down by the mouth then travels to the stomach via the esophagus. From there, it goes to the stomach. It is further broken down through acidic digestive juices and bacteria. And then it goes to the small intestine. The small intestine does have three different sections to it, and it continues to break down food and also begins to absorb a lot of nutrients into the bloodstream. By the end of the small intestine, once food has gotten to that point, it's mostly liquid form. So it starts as semi solid and then ends in liquid form, at the end of the small intestine. Next up is the large intestine. So that is mainly responsible for water absorption, and it's the last portion, also referred to as the colon. Then things end in the rectum and anus, which controls the exit of stool from the body. We also have the pancreas, the liver, and the gallbladder, which are all very important organs for digestion. The pancreas makes digestive liquid, and that further breaks down carbohydrates, fats, and proteins. The pancreas is also responsible for making insulin. So if you ever think about blood sugar control, perhaps if you have diabetes, that is where insulin is created. So that is super important for blood sugar control. The liver also processes nutrients absorbed from the small intestine. The liver can be thought of as our body's detoxification center. So it really helps detoxify harmful chemicals, and it also helps break down many drugs. So that is why you might have heard that certain drugs can cause liver damage if they're not taken as prescribed, because it's overloading the liver, which would break it down. And then the gallbladder that stores and concentrates the bile that is produced by the liver and then releases it into the small intestine to further absorb and digest fats. So, again, all of these organs have a job, and their main goal is to break down food into usable parts and nutrients. As you can imagine, sometimes things go wrong. Chances are we've all experienced some sort of digestive discomfort, to some degree, and some of us might even experience digestive disorders. So let's take a further look at that. Digestive discomfort is very common. Chances are you've experienced this already in your life, and you will experience it again. There can be multiple causes, and it's typically temporary and easily managed. So when you have discomfort such as bloating or heartburn, which we'll talk about in a second, chances are you kind of know how to manage that, and it typically passes with time. This is different from a digestive disorder. These are chronic, they're serious, they need to be treated by a doctor. And unfortunately, they're not always easily managed. They are less common, but if you do happen to have a digestive disorder, you're in good company. Between 60 and 70 million Americans are estimated to be affected by a disorder of digestion of some sort. So, what are some signs of problems with gut health? There are many. Again, most of us have experienced these. We can even go far as to say as probably everyone at some point will experience digestive problems. The first sign of problems in the GI tract often include one or more of the symptoms listed on the slide here. So things like abdominal pain, bloating, loose stools or a change in stool, constipation, heartburn, nausea, and vomiting. These are all very common symptoms of some sort of problem. Again, most of these are short term and easy to control, but sometimes they linger and they become really difficult to manage. It's important to recognize these signs and symptoms and when it's time to seek care. So let's talk about that. When is it time to see a doctor? When abdominal discomfort or symptoms last for more than a few days, it's a great idea to seek out care from your primary care physician. If it feels abnormal or if it worries you, that is also a really good sign to talk to someone about it. And it's really helpful to go into those appointments with some information for your doctor so they can best treat you. It's helpful to keep a log of things like the duration and frequency of symptoms, the frequency of bowel movements, any recent dietary habits or changes. Did you start a new diet? Did you make any changes to your diet? What is the consistency of your stool? And definitely make note of that if you notice a change of some sort. And then also keep track of any medications you've taken, especially if you've started or stopped a medication recently. Rule of thumb here, if in doubt, talk to your doctor so that way they can help give you the best plan of care possible. So that is some information on when to seek help from a primary care physician. In some instances, some symptoms do indicate a possible medical emergency. So when should we seek care in the short term when something is urgent? A couple symptoms to note. When there's blood in the urine, a fever over 100 degrees Fahrenheit, if you're pregnant and experiencing digestive issues or discomfort, if you recently had surgery, if the stomach is tender to the touch, if you notice blood in the stool, red blood, or also black and tarry substances, which can be dried blood and indicate a bleed higher up in the GI tract. And then also, if you're vomiting blood, these are all signs and symptoms that could indicate a serious problem that likely need emergency medical care. So that those are the times to seek care from the emergency room. Okay, so there are a number of common digestive disorders which we will talk about in more detail, many of which you've probably heard about or perhaps even experienced yourself. And taking a step back here, a disorder is any health problem that occurs in the digestive tract. So, a digestive disorder, again, is any health problem that occurs somewhere in the digestive tract. And these conditions might range from mild to serious. So, let's take a closer look at each of these disorders here. GERD, or gastroesophageal reflux disease, is as persistent heartburn or acid reflux. And if we break down the name, gastroesophageal reflux disease, we can better understand the mechanism behind this disease. So, When I see gastro in a gastroesophageal, that makes me think of the stomach. When we see esophageal, that refers to the esophagus and reflux disease. So, what's happening here is the contents of the stomach leak backwards from the stomach into the esophagus, and that can cause a lot of discomfort. The contents of the stomach, as you recall, are acidic. And so when that lower esophageal sphincter relaxes abnormally or weakens, that's when we get the backflow. So the stomach contents again go backwards into the esophagus, which over time can irritate the esophagus and lead to inflammation. Some common signs and symptoms of GERD are heartburn, especially after eating. It might worsen at night. You can feel chest pain. There can be difficulty swallowing, perhaps even regurgitation of food, and just feeling like there's a lump in your throat. These are all common signs and symptoms of GERD. There are also some notable risk factors for developing GERD. So these include obesity, hiatal hernias, pregnancy, connective tissue disorders, and delayed stomach emptying. Some of those are not in our control, but there's a lot that we can do to reduce the aggravation of acid reflux. So we can stop smoking or reduce smoking. We can avoid eating large meals at night. We can avoid eating certain fried or fatty foods. And then also certain beverages are known to aggravate GERD symptoms. So these include alcohol and coffee. And then also certain medications such as aspirin can aggravate acid reflux. Lifestyle changes can also help reduce the frequency of acid reflux. So, maintaining a healthy weight, stopping smoking, avoiding lying down after a meal that triggers reflux. The rule of thumb there is try not to lie down for about 3 hours after eating and avoid snacking before bed. And then also just eating more slowly and chewing more thoroughly can help avoid reflux. When people experience GERD, they are typically prescribed an over the counter or perhaps a prescription medication to help with symptoms. Okay, so our next disorder that we'll be discussing today is irritable bowel syndrome or IBS. So, this is a very common disorder. About 12% of the population is affected, and the effects of IBS are largely in the large intestine. So, these signs and symptoms, they vary, but common symptoms include abdominal pain, cramping, or excess bloating, excess gas, diarrhea, constipation, or sometimes both. Interestingly, IBS is not a disease, but rather it's a group of symptoms that happen together. So, unfortunately, there is some mystery surrounding IBS. The exact cause is not known, but there's a lot of clues that help indicate one's risk of developing IBS. And it's important to know these risk factors because IBS is considered to be a chronic condition that does need long term management. So, again, symptoms of IBS can be triggered by food. Some people have worsening in their symptoms after consuming certain foods or beverages like wheat, dairy, citrus, fruit, beans, cabbage, milk, or even carbonated drinks. Sometimes stress increases IBS symptoms, and even hormones can affect IBS symptoms, which is why it is thought that women are twice as likely to have IBS. And this could indicate that a hormonal change can play a role in IBS. So, what are the risk factors? Interestingly, most cases occur in people under the age of 50. So, age is a risk factor. Again, women are more likely to experience IBS. Genes might play a role, so a family history can increase your risk of IBS. And then also mental health problems such as anxiety, depression, and other mental health diagnoses are associated with IBS. So the treatment does focus on relieving symptoms. And there's typically a combination of medication, diet changes, and therapy. Some people find that treating depression, for example, can help alleviate symptoms of IBS. And I think whether we have a mental health diagnosis or not, we can all relate to the idea that stress impacts our appetite. I know for me, in times of stress, the last thing I want to be thinking about is eating. So over time, you can imagine, the relationship between mental health and digestion and how that might play a role here in IBS. Okay, so next up, we will discuss Crohn's disease. So again, this is a disease that there is some mystery tied to it. The exact causes are still unclear, but we know that Crohn's disease is an inflammatory condition of the bowel. So inflammation in the digestive tract can lead to abdominal pain, severe diarrhea, fatigue, weight loss, and even malnutrition. There is no cure, unfortunately, but therapies can greatly reduce its signs and symptoms and even bring about long term remission. These signs and symptoms do range from mild to severe, and importantly, for most people, these symptoms develop gradually. However, in some people, these symptoms have a very sudden onset without warning. And some people, they might develop symptoms and they might experience periods of no signs and symptoms, also known as remission. Again, the cause is not known, but there are a number of factors that are thought to play a role here. So, again, genetics. If someone has a family member with Crohn's disease, that could increase your risk of developing Crohn's disease. And the immune system is thought to play a role in the development of Crohn's. Some other risk factors, again, age. So, people are more likely to experience this condition when they're younger. Ethnicity does play a role. So white people do have the highest risk of developing Crohn's, and other factors such as cigarette smoking and taking certain NSAID drugs, NSAID as in nonsteroidal anti-inflammatory medications like Advil and Motrin, are also thought to play a role in Crohn's disease. There is not a single test to diagnose Crohn's, unfortunately. So doctors will have to run several tests and do a physical examination to determine if someone does have Crohn's disease. So there's not one silver bullet that treats all cases of Crohn's disease. So it is a matter of working with a doctor on finding a treatment that works best for you. And the goal here is to reduce inflammation and limit the complications that can result from Crohn's. As we talked about, up to this point, treatment for Crohn's is similar to the other conditions in that it's typically a combination therapy. So it can consist of various medications, diet, and changes to lifestyle. A lot of these dietary changes will be limiting dairy foods, trying low fat foods. Some people even need to limit fiber if that is a problem food for some people. And then also avoiding other food groups such as spicy foods, alcohol, and caffeine. Some other changes that are really helpful for reducing symptoms are eating smaller meals, drinking plenty of fluids, reducing stress, and just relaxing regularly. And of course, stopping smoking. As a last resort, if the diet and lifestyle changes and medications don't work, some people do need to undergo surgery to help better treat Crohn's disease. All right, and colorectal cancer. So, colorectal cancer, that refers to cancer in the colon and the rectum. These cancers are similar, which is why they're sometimes lumped together and just called colorectal cancer. So, the cancer, again, is formed in the colon or rectum. And if you have ever done a colonoscopy, chances are you've heard of a polyp before. So this can be thought of as a precancerous growth. When that polyp grows more and more and it becomes out of control, that is typically when they become cancerous. And these are formed on the inner lining of the colon and rectum. There are some symptoms to look out for this type of cancer, and they include persistent changes in bowel habits. So some people might have diarrhea, others might have constipation, or just some sort of change in the consistency of your stool. Rectal bleeding, blood in the stool, persistent abdominal discomfort, a feeling that your bowel does not empty completely, or unexplained weight loss, weakness, or fatigue can all be signs of colorectal cancer. Prevention is key here because many people experience no signs or symptoms in the early stages of the disease. If you are due for a colonoscopy, I do highly encourage you to talk to your gut doctor and get that scheduled. There are some both controllable and uncontrollable risk factors. So, things that we can't really control are our age. A majority of cases occur in people older than 50 years old. Black people are at a higher risk of colorectal cancer. And people with a personal history of polyps or inflammatory intestinal conditions can also have a higher risk of colon cancer. But there's a lot that we can control. Heavy alcohol use, tobacco use, a sedentary lifestyle, obesity, and diet all play a role, especially a diet that is low in fiber but high in fat and high in red meat and processed meats. These are all risk factors that increase the risk of developing colorectal cancer. So, again, like I mentioned, prevention is key here. Please talk to your doctor about what options are best for you, especially if you're due for a colonoscopy. That said, I understand that colonoscopies are not very fun to prepare for or undergo. So, if what is holding you back is the thought of a colonoscopy, I do encourage you to still talk to your doctor. There might be a chance you can do an at home test that is much less invasive and a little bit more comfortable. So, again, there are different lifestyle changes we can make to reduce our risk. So, we can eat a variety of fruits, vegetables, whole grains, choose to drink alcohol in moderation, if at all, stop smoking, exercise most days of the week, and maintain a healthy weight. These are all things we can do to decrease our risk. Okay, so you've probably heard of different food allergies and intolerances. Chances are, if you don't experience one of these, you probably know someone who does. So, what's the difference between an intolerance and an allergy? I like to think of intolerance as a mechanical error in the digestive system. So, it's occurring in the digestive system, and it happens when the body can't break down a food for some reason. So, individual components of food just simply cannot be processed by the digestive system. These are more common than allergies, but they are less serious. The reaction for an intolerance is typically delayed up to 24 hours, and some people find that they can still consume small amounts of the food, even if they have an intolerance. Most commonly, intolerances include wheat, gluten, dairy, meats, and even some fruits and vegetables. And this is different from food allergies, which can be thought of as a hypersensitivity to certain foods. And this hypersensitivity triggers an immune system response. And the body is quite literally trying to kill off the food. So, again, as you can imagine, this can be very severe and perhaps life threatening. The reaction is going to occur immediately, but it can also occur in a couple of hours. So it does vary by person. Whereas intolerances can result in people consuming small amounts of the food, when it comes to allergies, it only takes a small amount of food to be consumed or even touched or inhaled to cause a reaction. And these symptoms include things like hives, shortness of breath, upset stomach, and in some cases, anaphylaxis. I have experienced this when I was a young kid, especially for certain foods. For some reason, I was allergic to corn as a kid. I have since outgrown that. But when I would eat corn when I was younger, the inside of my ears became itchy, and I did experience things like hives as well. So, again, this does look different for everyone, but super important to avoid the allergen when possible. The most common allergens are things like cow's milk, fish, shellfish, tree nuts, and peanuts. And let's talk about a very specific food allergy here, celiac disease. I'm sure you've all heard of this. And again, since it's an allergy, it's an immune reaction to gluten. Gluten is a protein that is found in wheat, barley, and rye. So again, wheat, barley, and rye. And for people with celiac disease, eating gluten triggers an immune response in the small intestine. And over time, this is very, very damaging. So it's very important for people with celiac disease to follow a very strict gluten-free diet. The reason for this is that the inflammation that is caused by consuming gluten in people with celiac is that it can cause reduced nutrient absorption. So untreated celiac disease can result in reduced nutrient absorption, which over time can become very serious. And that is really the best treatment is just avoiding gluten because there is no cure for celiac disease at the moment. Again, these signs and symptoms can vary, but they often include diarrhea, fatigue, weight loss, bloating, gas, abdominal pain, nausea, vomiting, and constipation. The precise cause is not known, but again, with all these conditions, there are risk factors. So there could be a genetic component, and then also some conditions like type 1 diabetes, Down syndrome, Turner syndrome, autoimmune thyroid disease, microscopic colitis, and Addison's disease are all thought to increase the risk of celiac disease. Interestingly, a lot of people with celiac disease don't know they have it, but it can be diagnosed with two blood tests. So, if you feel that you might have an intolerance to gluten or perhaps even celiac disease, we do encourage you to make note of any symptoms you're having so that way you can get best treated by a doctor. So, how does one eat gluten free? This is a lifelong change for those with celiac disease, and it is not easy. Gluten does show up in a lot of different food groups, unfortunately, especially packaged foods, and that can make it hard to avoid it sometimes. The biggest tip is just making sure that you read labels and avoid packaged foods unless they're labeled as gluten free or have no gluten containing ingredients. And again, gluten is a protein found in wheat, barley, and rye. The common foods that contain gluten are things like pastas, cereal, baked goods, beer, even things like candies, gravy, and imitation meats or seafood can also contain gluten. However, there's also a long list of foods that are naturally free of gluten. These include things like brown rice, quinoa, eggs, honey, lentils, peanuts, seeds, and the list goes on. So there are a lot of options out there, but again, it can be hard to avoid sometimes in the packaged foods. And the people who benefit most from gluten free diets are, of course, people with celiac disease and also just people who have an intolerance to gluten. To best approach the food label, it's important to read it very carefully. If you're looking for gluten-free items. So the FDA requires products to contain less than 20 parts per million of gluten to be called gluten-free. Other common labels besides gluten-free include no gluten, free of gluten, or without gluten. And those labels are regulated. So again, they need to have less than 20 parts per million of gluten in order to make that claim. And the reason for this is that it's the lowest level that can be reliably detected in foods. Most people, even with celiac disease, can tolerate foods with this small amount of gluten. And it is important to be aware of the may contain statement because sometimes although a food has like a may contain statement, it might not be created with gluten containing products, but if it says may contain, then it can indicate cross contamination because the same equipment might be used to make a variety of products, some of which contain gluten, others might not directly contain it, but again, cross contamination can happen. So that's an important label to look out for. Okay, so we talked a lot about gluten, and you might be wondering, should I go gluten free? There's a lot to consider here, and as always, we encourage you to talk to a doctor before making any dietary changes. But a rule of thumb here, unless you have celiac disease, there is no reason you must be gluten free. In fact, some people who decide to eat gluten free without celiac disease, they can over time begin to become deficient in certain vitamins and minerals, and they can actually gain weight. So there is really no evidence that switching to gluten free for health benefits such as weight loss, increased energy, or general health, there's really not much evidence for that. And a couple other things to consider here. It's more expensive to follow a gluten free diet because the gluten free analogs to foods that typically contain gluten are more expensive. And there's also certain additives that can contribute to weight gain, such as added sugar. So, again, for most people, they probably don't need to become gluten free unless they're told by a doctor to do so. So, when it comes to overall health and how to choose a healthful diet, balance is key. And it's really important to choose a diet that contains a lot of the following food groups. So, lean protein, such as meat, poultry, and fish, as well as plant based sources of protein, such as nuts, seeds, and beans or legumes. It's helpful to limit certain processed items like cookies and candy. If you eat dairy products, you can choose low fat dairy products like yogurt. And then, as always, a variety of fruits and vegetables and healthy whole grains. I'm sure you've heard the phrase eat the rainbow. And you can see on the slide here, what appears to be a mother and daughter, are choosing a lot of brightly colored fruits and vegetables as they make their salad. So, eat the rainbow. It helps to get more nutrients that way. But again, if you think you might have celiac disease or gluten intolerance, it's best to see your doctor before you go gluten free. Because once a person begins to avoid gluten, it can be really difficult for a doctor to establish an accurate diagnosis. So it might sound a little backwards, but if you're experiencing symptoms or discomfort after eating gluten, don't cut them out of your diet until you speak to a doctor. That will help them diagnose you more accurately. Okay. So I know we talked at this point mostly about things that can go wrong with the gut and digestion. So we'll end things on a more positive note. How can we better promote gut health? What is a healthy gut? Gut health overall describes the function and balance of bacteria in the GI tract. And why should we pay attention to this? Well, first of all, it helps our immune system and it helps us properly absorb nutrients. We really can't function without a healthy gut because the gut, again, is responsible for breaking down food into nutrients that the body can use, and it's transported into the bloodstream and delivered throughout the body. And that's a really important job that can only be possible with a healthy, functioning digestive system. Interestingly, over half our immune system is thought to be included in the gut or the digestive tract, and this helps us fight off infections from things like bacteria, viruses, and even fungi. A healthy gut can also help reduce discomfort from eating, and it does reduce the risk of different diseases as well. In- Interestingly, sometimes the gut is referred to as the second brain. The gut and the mind communicate constantly through different nerves and hormones, and keeping them in both healthy is a really helpful way to maintain general health and well being. So, just by eating better and maintaining a healthy gut, chances are you'll feel much better as well. So here are some tips to do that. Exercise, exercise, exercise. I know you've heard it a million times, and there's so many reasons to do it. This is one of them. So aiming for at least 30 minutes a day can be really helpful. Movement alone can help us stay regular with our bowel movements and help avoid constipation. A general rule of thumb is about 150 minutes of exercise per week for the average adult and 2 days a week of strength training. If you're not there yet, start slowly and build yourself up. Drinking water. So, drinking enough water, rule of thumb here, 8 ounce glasses of water per day. That helps remove waste and prevents dehydration and and helps aid digestion. If you're currently experiencing symptoms of digestive discomfort, maybe try experimenting with limiting alcohol and caffeine. These are digestive stimulants, and these can help disrupt different processes of digestion. As we briefly mentioned earlier, eat a balanced diet, especially with a focus on increasing fiber and increasing probiotics and prebiotics, which we'll talk about in a second. Paying attention to portion sizes and hunger cues can help you avoid overeating, which can then cause bloating, acid reflux, and other symptoms that are very uncomfortable. And lastly, manage stress. So, like we said, the gut is sometimes referred to as the second brain. So, our mental health is very connected to our digestive health. So, managing stress can help protect your gut. And so, try things like yoga, meditation, journaling, therapy, all really great options for reducing stress and anxiety. Okay, so we'll talk a little bit about fiber. Most people are lacking fiber. It's a very important nutrient to get from the diet, and it's found from plant based sources. So, things like fruits, vegetables, beans, legumes, and whole grains, they're the heavy hitters when it comes to fiber. Fiber helps normalize bowel movements, it prevents constipation and adds bulk to watery stools, and it also lowers the risk of developing hemorrhoids and colorectal cancer. So, fiber is very protective. Other health benefits to fiber include things like lowering cholesterol levels, help controlling blood sugar levels, and can even promote a healthy weight and help you live longer. So, there's a lot of reasons to eat more fiber. Again, most of us are lacking it. There are some recommendations for how much to eat. So for men 50 years old or younger should be consuming about 38 grams per day. And women 50 years or younger should be consuming about 25 grams per day. These recommendations do decrease slightly with a higher age. So for men who are 51 years old or older, they should be consuming about 30 grams per day. So it goes down from 38 to 30 per men. And then for women, it goes down from 25 grams to about 21 grams after 51 years old. Okay. So, gut bacteria, gut health. You might have heard the term microbiome. This is what we're talking about. So, we're referring to the microorganisms living in our intestines. There's hundreds of different species of bacteria in a person's digestive tract. Some are harmful, but many are beneficial and actually necessary for a healthy body. These good bacteria help protect you from harmful bacteria and fungi, and they also send signals to your immune system and help regulate inflammation. So there's a lot going on, and so we should really take care of our microbiome, which can also be called the gut flora. For example, it helps with digestion, nutrient absorption, and also even vitamin creation. Vitamin K is actually produced from gut bacteria specifically. And these bacteria can also produce short chain fatty acids, which are the main nutrient source of the cells lining the colon. Importantly, antibiotics can unfortunately kill bacteria. I know sometimes we need antibiotics and we might not have a choice, but they can do damage to the gut bacteria, which can result in digestive discomfort. So, if you are concerned about that, please speak to your doctor about how to address that. But one way to potentially promote gut health and microbiome health is through probiotics and prebiotics. Really hot button issue right now. I'm sure you've heard a lot about it on social media. So, what are they? What's the difference? Probiotics are live bacteria and yeasts that help keep your gut healthy. So, again, they are live bacteria. So, they are the pros. That's how I remember probiotics. So, these include things like yogurt, sauerkraut, and kimchi. Generally, these are fermented foods. So, again, yogurt, sauerkraut, kimchi, among others, such as tempeh. And fun fact, pickles can actually be fermented. One way to check if they are fermented is by reading the food label of pickles. As a rule of thumb, if pickles contain vinegar, they're not fermented. Vinegar is added to some pickles to give it that taste that resembles fermented pickles, but it's truly just imitating the flavor of fermented pickles. So again, if it contains vinegar, chances are it's not fermented and isn't offering as many of the benefits to your gut health and the probiotics. Now, probiotics are different from prebiotics because the prebiotics can be thought of as the food for the probiotics. So prebiotics are the type of undigestible fiber that stimulate the growth of the healthy bacteria in the gut. So again, the pre kind of feeds the pro. They act like fertilizers in a way, if that helps you remember the difference as well. So again, they're promoting the growth of healthy bacteria. You can get these through both food sources and supplements. If you're interested in supplements, please talk to your doctor about that. And they're found in a lot of fruits and vegetables. So bananas, honey, onions, leeks, and more all contain prebiotics. A fun fact about bananas, try experimenting with them and eat them when they're not ripe. So when they're a little bit green, they tend to have a little bit more fiber and offer a little more benefits in terms of prebiotics. When they become super ripe or perhaps overripe, they contain less fiber and more sugar. So just one thing to think about here, an easy way to get more prebiotics. So hopefully you have a better understanding of gut health after today's presentation, and hopefully you have one way to implement what you learned today to improve your gut. These are our references. I'll leave these up for just one more second here for reference. An important statement about discrimination. And we encourage you to stay in touch. I left on the screen a bunch of resources for members here. So mail order pharmacy, Medicare Advantage, a telenurse service, and also a success story tracker. So if you have been making really great progress to your health, whether it's related to gut health or not, we encourage you to tell us about it. Share your success with us using the link at the bottom of the screen or the QR code. Thank you very much for your time today, and we will be in touch.